So what can a patient do before knee replacement surgery to ensure they have a successful outcome? You know, we've looked at this from a number of different ways. There are preoperative modifiable comorbidities that we can change before surgery. And so modifiable risk factors are such weight loss, getting yourself to a safe range. Modifiable risk factors include if your diabetes is uncontrolled, getting it more controlled. Smoking, stopping smoking. We know nicotine. Everyone looks at nicotine and they say, oh, it's just my lungs. Oh, it just hurts my lungs. But nicotine constricts the blood vessels, which decreases the nutrients in the food that may go, or I call it food, but the nutrients and the white blood cells and all the different good stuff from going to the knee after the replacement. So nicotine is really bad for the outcomes of surgery. Proper diet and nutrition. We know malnutrition plays a role in increasing the risk of problems. And so while we don't test for that always, we can look at albumin or your vitamin E, vitamin D levels. And if those are low, you may have more poor nutrition and you have an increased risk of problems. Another way we've looked at making you a better candidate for hip or knee replacement is prehabilitation. Everyone has heard of rehabilitation and getting yourself fixed up after surgery, but certainly making yourself a better candidate before surgery in regards to muscle strength or mobility plays a role. We ask simple questions like, can you walk a city block without getting short of breath? Can you go up one flight of stairs without getting short of breath? And so preoperative modifiable factors are now at the forefront of what we're doing to make sure you're safe for surgery.